Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Imagine this. It's the Wednesday before Thanksgiving. A patient is scheduled to start services on Monday, but before that can happen, their insurance needs to authorize the level of care, or the patient could be left facing a massive out-of-pocket bill. Oh my gosh! Ba, ba, ba. That scenario isn't rare. It actually happens all the time, and today we are unpacking why. Welcome back to the Sit and Stay podcast by RipsyTech, the show all about mental health practice management, helping you both keep your patients and your business healthy. I'm one of your hosts, RipsyTech's product manager, Parker Anderson, and as always, I'm joined by RipsyTech's founder and CEO, Tom Tarshis. Hi, Tom.
Hey, Parker. Love the intro. Very well done.
Thank you. I tried to write up something a little cinematic for the listener today. So before we actually dive into the rest of that topic, I just want to share a quick resource for our listeners. If you, listener, are in the early stages of starting a private practice, we built a free course that walks you through from the idea of opening your own practice all the way to forming a legally registered business with everything that you need to support yourself. I'm talking all of the technology, everything. It's under 2 hours. You can watch it anytime at ripsytech.com/practice. All right, Tom. Today we are talking about something most people don't think about until they are in the thick of it. Insurance authorization for higher levels of care. So for anyone listening that's unfamiliar, insurance companies generally approve lower cost services like weekly therapy without too much friction. But when it comes to more intensive or more expensive care, like your IOPs, that's intensive outpatient programs, which we'll be talking about in today's example, but that also applies to like PHPs, partial hospitalization programs, or residential programs, etc. So insurers are almost always requiring clinical justification before they pay for these types of services. And without that approval, patients can risk taking on enormous financial burdens. So as you and I both know, getting that authorization is much easier said than done. And you wanted to talk about this today because you recently went through this process on behalf of one of RipsyTech's clients who is launching their own IOP. And for a little bit of context, I used to be the person making every single authorization call for one of your former clinic's IOP programs. I've handled authorization for well over 100 cases and trained other people to do it. So I'm very curious to hear how things went on your end. So Tom, with all that said, walk us through what happened. What did your journey look like from your perspective?
Yeah, no, and I think we talked about, let's mix up our podcast a little bit and maybe try a show like this where we talk about an experience and have it's not healthy, but I actually have a full calorie Mountain Dew, like mini can at least, and that sort of helps with dealing with some of these issues. And
just one of those days.
But hey, and I like set a record on pull-ups this morning thinking about this podcast and taking out that aggression, but not.
Wow.
Just kidding.
I kind of want to know how many pull-ups you did, but I don't know if the listener does.
We'll talk about my workout routine on an upcoming podcast. But and so Parker, and we're late filming this podcast episode because I was dealing with another issue, which maybe will, if this episode is well received, like we're happy to share more of these stories. But knowing that this is we're sort of full service at RipsyTech, and knowing that for people who don't know much about, who've never done this before, it can be an awful process. And so, the offer that we threw out there was, hey, we'll help you do this call together. I think the one thing we want to be clear to differentiate is this is a program that is in network with this given insurance. So we're not trying to negotiate a out of network single case agreement, which is different, and which this program will be doing. And will be helping with. So that could be another episode. But they're in network with this insurance company. So we just need to get authorization for this person to join the intensive outpatient program. So because I had offered to do it with them, actually the first attempt, Parker, was on the Wednesday afternoon. It was late because of, there was an intake that day, and for various reasons, as happens, the documentation wasn't ready till sort of later in the afternoon. But I three-way called with the one of the clinical directors, the person who did the intake, to go through the process. And when we pushed the buttons to try to reach someone, they're on Eastern time, and so they were closed. And so
the insurance company was?
The insurance company was. So it was maybe like 4 o'clock Pacific, and this is Eastern time for this insurance, and so their offices were not open. So that was the joint call.
Goodness. Okay.
Okay, and so the next day was Thanksgiving. So I didn't try.
Just take that off the board. Yeah.
Take that off the board. And then on Friday, the day after Thanksgiving, I didn't want to disturb the other person's day after Thanksgiving, Black Friday, whatever they were up to. But I have no boundaries between work and personal. No, I was, wanting to ensure success for our clients, and as is just my nature, I thought, well, let's give a call on Friday. And what I've taken to doing a little bit, Parker, is using Google Meet to take notes on what's happening in the different calls and giving the little summary. And I always love the the summary statement from the Google Meet documentation was: Thomas Tarshis made 2 attempts to contact the insurance company, first confirming themselves as a provider and the correct member ID, but the call disconnected after they couldn't find the information, and then called back and finally got through. And then the call ended with an automated message saying we're closed today. So they were actually closed on Black Friday also.
Okay.
And
now
just
I'm
to
left
give
in suspense over what happened.
Yeah, so just to give
continue.
Yeah, and just to give the times here. So and this was fairly maddening, right? Because you do the number, you do the automated messaging system. This one was very quick to hang up on me after I didn't push a button in time to specify the reason for my call. So that was at the 5-minute mark I was hung up on. And then I called back and was able to sort of get through with some verification. But then I actually misentered the patient's date of birth. And often they'll let you sort of confirm if correct or not, but this particular automated system does not, and it just hung up on me. So that was hang up number 2 at 7 minutes. And then I called again, a third time's a charm, and was very careful. Sometimes they're still speaking and you start entering a number or a date. I'm like, I waited for the speaking to end. Smart. I used the keypad, didn't try to use the voice recognition. And by the 13-minute mark, it said, you're all good, but our offices are closed. Call back during regular business hours. So that was,
that was on Friday.
Black Friday. So 13 minutes and 2 seconds of my time on Black Friday. Okay. Not terrible, maybe, but to end with, call us on Monday. Maybe they could have said that at the beginning. I think the reflection, all these automated systems, oftentimes, you can look up claims or some payment information through these automated phone systems, But the reality is that's all really easily available online and through other portals. And I just can't imagine there's that many people using this slow punch in the numbers to get actually claim or benefit information anymore. And
Mm-hmm.
so the reason people are calling is to speak to someone. And it's maddening that they haven't, well, this is not just in the medical insurance industry, but putting up barriers to reach a live person is quite unfortunate. But that was Friday. That was just the little preview because the real fun was then on Monday, December 1st.
Okay.
So, and I think as you mentioned, this was the start date for the IOP
Right.
cycle. It's an
Right.
8 week,
And was
eight
this an
week.
IOP that? Sorry, I apologize. Was this an IOP that started in the morning or was it in the afternoon?
It was a morning IOP,
That's
and
worse. Okay.
and as you know, Parker, we often took chances with starting people without authorization.
Yeah, as long as the patient and or their family was aware of the risks of doing that, then you know it was up to them.
Right, right. And this is, a new program. There were, other patients starting. It would be a good, it, it's a good feeling to get your first 8 week cycle IOP going.
Yeah.
And so, the agency was kind of aware of this and they were going to go ahead and risk it. And if the authorization didn't come through, we're not actually going to charge the family, which is a very
Okay,
kind and
good. I was
ethical
just gonna
thing to
ask.
do.
Yeah.
From a business perspective, when you're up and rolling, it's not really the best. You always have to balance taking these types of risks. I could see where to just get the momentum going and get a new program started,
It
that
can be
makes
worth it.
sense.
Yeah.
Um, and and so it was still though it was Eastern time, so I took advantage of the time difference to actually call quite early in the morning from Pacific time,
Oh.
and
Okay. Smart.
and instead of sort of giving instead of reading the full summary, I'll just read the first sentence where it says Thomas Tarshis experienced significant wait times and multiple transfers, speaking with one, two, three, four, five. So here's that. Let's go
Oh
through
my
this.
gosh.
Let's go through this fun call, Parker. As
Five. All
how
right.
Let's get your guess.
Five people.
How long was this phone call?
That sounds well. Okay, five people, and you have to wait probably to every time you get transferred. You have to wait for that person to pick up. So, um, I'm gonna guess like an hour and 10 minutes or something.
Okay, let's remember that time, and we'll see how you did.
Okay.
All right. So, it's back to this sort of maddening system, but at least I had some experience with it from calling on Black Friday. And so I went ahead though and called, was careful with the automated system, um, got through to uh, got to the point within 2 minutes of being put on hold to wait for a representative. So actually
Okay.
meant,
I mean, that's actually a good sign that you're being
it,
told that a representative will pick up the phone. Okay.
yes, I was very happy to get through, member ID, verify date of birth, and get to actually, I was able to identify it was from a provider's office. And so, yeah, at 2 minutes, I was on hold waiting for someone, and that person um, I was able to speak to at the 15-minute mark. So 13 minutes waiting,
Oh.
which not awesome.
Yeah.
I think it did say there was like five callers ahead of me. I think it was one of those, but it
Okay.
it
That's nice.
it didn't give one of
Yeah.
the push three and we'll call you back.
Do those
Which
ever work?
they do, but I when it's a really important call, I
Yeah.
share that skepticism. The reason, and what you get good at over the years is having other activities to do on the computer while you're waiting on hold. So
It's huge. Yeah.
yeah, so we use Google Voice to make the phone calls. Yeah, I was on hold for 13 minutes, but that's good email time. And so when we look at the total time at the end, it's not really that total time lost and being non-productive. It does hurt your productivity, but often you can get other stuff done knowing it could be a long phone call.
Right.
But to begin with the joy, happy to speak to, well, I'm tempted to say everyone's name, but we'll try to keep it very anonymous. But it's just a funny group of names. But so
Person
we'll
A was.
yeah,
So you got on the phone with person A, 15 minutes into this phone call?
15 minutes, and then was able to give the information. And then, as often happens, Parker, within a minute, they quickly looked it up and they said, oh, you know what? This patient's insurance is handled by another team. So I'll need to go ahead and transfer you.
Were you giving all the clinical info and everything before they said that?
Parker, we're not even close to finding the person to give. Yeah, and that's a good comment though, right? The whole point of this call is to give clinical information on the patient and request the authorization.
Yeah.
The other thing that drives me crazy is you punch in your identifying information on the automated system, but then you always have to repeat it to the people once you get on the phone. But
yes, you do.
But as does happen, this was the number on the back of the insurance card we called, and then we got through to a person, and they said, we are not the right people, and we have to transfer you to a different department. So that was at the 16 and a half minute mark. That
okay. All right. 90 seconds. I'm rooting for that first person. They're doing a good job. Okay.
Yeah. Okay. Then I'm transferred to person B. And what I've learned, Parker, and this is great advice for our listeners, always request a warm transfer. So,
yes. Oh gosh. Yes.
What is a warm transfer, Parker?
A warm transfer is when you are on the phone with somebody and they are connecting you to somebody else, and they do so by, I guess, introducing you to that other person while still on the phone with you, saying, hey, I've got Susie on the other line. Here she is. Boom, done. As opposed to, I'll send you over there, which is a cold transfer. They're no longer on the phone with you. Now you're left waiting for, Susie or person B to pick up, and good luck.
Yeah, 50-50 on pickup versus being disconnected.
Just random hang up. Yep.
Yeah, so, and then they did get the callback. Always make sure you give the callback number. So person B verified Thomas's information, including their name and callback number, which is important. And I pushed for the warm handoff. So then this was person B, and it reached them. And then this was at the 17 and a half minute mark. Again, gave information again on where it was calling from. And then person B said, oh, you know what? This is actually a different plan that I have very limited access to. And so I need to transfer you to another colleague who can help you. Okay. Thomas Tarshis expressed frustration about this being the, quote, fourth transfer, and requested a warm transfer to avoid disconnection. That would be my third transfer. So I think I lied saying.
You maybe exaggerated.
Yeah, but I don't feel bad about that. And if you count my 2 calls the other day.
Sure.
Right. So we're on to person 3, person C.
Yes, person C.
Oh my gosh. Yeah. So that was at the 21 minute mark. Now it actually took 15 minutes to get to the next person. So, Mark,
were you on hold?
I was on hold with the person, and I did let the name slip. The name is Mark. I'll I don't think we need to beep it out.
There's a lot of
Hard
Marks
to
out
imagine.
there.
Yeah. But I appreciated Mark being on the phone line with me for those 15 minutes. And then we did
Okay, so go Mark, if anything.
go Mark. And then we did get the next person on. And Mark explained the reason for the call. And then this other person apologized for all the transfers. And then,
Which is probably how they start every phone call that they're on.
yeah. And then, Parker, get ready, because the person said
Stop.
that we are still not at the correct place, and they potentially tried to explain that there were problems with being transferred offshore and onshore and everything else, and then that there had to be one more transfer in order to reach the right person. And I didn't. It's none of these people's faults, right? Like how the systems are, and I try to be. In general, my mantra is be kind. So
Yeah.
it is important to express frustration, because hopefully there's some feedback that they can make to improve, if you're not cynical and that all these transfers, a couple of these transfers weren't have supposed to happen. But
I just have a quick question. Did all of this originate from just calling the number that was provided to you on the back of the patient's insurance card?
yes.
Okay, that's the part that's wild to me, is that, you're calling the only resource that you have available to you, and that even when you do that, like, you start at the most correct possible place, you end up on we're on the fourth call now?
This is the fourth. Yep, about to go to the fifth.
Okay. So
Yeah,
continue.
yeah. So then, and there were some apologies here, but then we did get to the fifth person, who was the right person to speak
The
with
final boss?
at this moment.
Okay.
Don't get too excited yet, Parker.
Okay.
Right. And so
Okay.
I was, you're right. We're just hoping, like, is this the person who can take the clinical information and maybe help get an authorization? So got to this person, they took extra information about the IOP program. They asked who the clinical director was. They asked who the psychiatrist was. Got information on, the start date of the program and how many weeks it was going to be. And
Okay, the person knows
then,
what they're talking about.
so that got us to 50 minutes. And at the 50-minute mark, then after giving this other information that they had asked for about the program, I had said, okay, great. Can I give you the clinical information? And they said, oh, no, I'm not the case manager or anyone to take the clinical information. I'm just the person to assign you a case manager to present the clinical information to.
That's not that irregular. That's pretty typical. But to go through 5 calls to get to that person is wild.
Right. Like that should be the person one phone call to get through, sort of
Yes,
verify the
100%.
program eligibility and then assign. That would be very reasonable. That was at the 50-minute
We're not
mark.
operating in a world of reason here. Okay, continue.
So yeah, so then that phone call with that person and then being on hold and them coming back and telling me, okay, here is who the case manager is going to be. I did get at least the case reference number. It's good to get a number. So like, here's your reference number. Here's the phone number and extension of the person to call and their name. And then let me go ahead and transfer you. So there we were at that point. they went ahead and said, we'll go ahead and do the transfer, just put in the extension. Then at the 1 hour and 4 minute mark, that transfer happened. And then unfortunately, they did not pick up. So it went to voicemail. And it's this question of, it does ring a certain number of times, but in all honesty, I'm not sure if they ever answer the phone. And I don't know, Parker, in your experience, if
No, that's I think that's pretty typical. I mean, there was one insurance company in particular where you would get assigned a case manager, and then it was just expected that you were going to be leaving a voicemail, and so we wrote a whole voicemail script for leaving every single piece of information that they were going to want. So that yeah, that's pretty normal. If you ever got somebody live on the phone, it was usually because they were calling you back.
gotcha. And I will say, as a Ripsy AI tool, we do have write your IOP authorization dialogue. So I had that prepped and ready from the beginning, and that saves time to be able to
Well
have that
done. Nice
dialogue.
plug for the software.
Look for those plugs. And we also had completed a locus questionnaire justifying IOP level of services.
Nice.
So the phone went to voicemail, and I went ahead and left clinical information, and mentioning that the patient was starting the IOP on this day, and so I was hopeful to get authorization. I did leave the name of the clinical team if what I left wasn't enough, though I felt it was pretty convincing. And that call ended at the 1 hour and 7 minute mark. So that was Parker. You were very close, sir, with your prediction.
Really close. Yeah, I was estimating roughly like 12 to 13 minutes per person based off of 5 people. And that's like 5 minutes of maybe talking to them, or I was thinking about 5 minutes of talking to them before realizing that you're at the wrong place, and then about like 7 or 8 minutes to wait for the next person. So okay, it's not an exact science, but
Yeah, and at this, at this point, the program's beginning. At least I've left clinical information somewhere, and hope now just waiting for that call back.
wait. Okay, wait. Today's Thursday, and you left this clinical information on Monday, and they haven't called you back yet?
Well, here's the updates after Monday.
Okay, sorry. Continue.
So on Tuesday, after around 10 a.m. or so, it was getting late morning here, so I know it's later there. I had no response. So I did give another call to the case manager saying, hey, this, just following up on this because the patient started. They do say, I think within 24 to 48 hours, someone will try to get back to you. Okay. And so I gave a call and a nudge, and then, trying to leave Monday, Tuesday, Wednesday, I see patients, so I don't have a ton of time, but trying to look if the phone rings to answer it. But there was a call back, but I missed it on Tuesday. But the callback said, hey, I'm the case manager. Can you please call and leave clinical information? That's what we need to process the authorization. So that first message, I don't think it was received. That first
like the voicemail that you left.
Yeah. So I think my second call, which is a good, glad I called again the next morning, that message did get a call back within a couple hours saying I need clinical information.
Okay.
And then just to get the timing of that was on Tuesday. And yeah, I just want to double check because then I did call and relieve clinical information. So that was So I got the voicemail late on the day Tuesday back from the person to leave the authorization. So I was mistaken about that. So yesterday morning at 9:22 a.m. I called again to leave the clinical information and request authorization, and gave a little plea around starting the program, etc.
Yeah.
Tried to leave my phone on. And then, Parker, I had not heard anything back. However,
However,
um, as I just the happy ending, or the good news to the story, is um, literally 15 minutes before we started recording this podcast, I didn't wasn't able to answer that phone call because I was on the phone for this other insurance issue that I alluded to earlier. But they called and left authorization for 30 visits beginning back on December 1st.
excellent.
So we have the auth number. It's good to
Excellent.
go. And so it's always appreciated, as you know, that if getting 30 visits authorized, sometimes you get six and you have to call back the
Right.
next week. But
Well, yeah, sorry. I say 30. 30 is like the standard amount to like request for, but yeah, sometimes it's 6, sometimes it's 10. Sometimes you get up to like sometimes you get the 10, then you get another 10, and then you're trying to get the last 10 or 12 or 8 or whatever, and then you run into a whole wall of like, well, why aren't they getting better? And then they need 10 more days, and it's like, dude, it's an 8-week curriculum.
yeah,
Anyway,
yeah.
I
But yeah,
can go
so
on.
that's that. And this is actually right. This is, I think, this is not something that we don't do this piece. Right. At Ripsy, we don't do this piece in general for our clients. Like,
That's
if,
right.
but given, for this clinical team, that's a great program, and very skilled people, want to set them up for success, and let, also prep them for what's in store.
Yeah.
That, right. So a total, this was maybe 2 hours of my time, multiple voicemails, and in order to like leave the clinical information and get authorization. And this is what is going to happen from their team. And so
Right.
I want them to go in with eyes open about what it means to be working with commercial insurances. Um, and so there was value in this experience. And yeah, I think the last time we did, it's been years, right? And nothing has changed a ton with this process. We'll have to do an update though, because there is a way theoretically to submit information online. And so I've been got
Yeah.
some of that access, and I'm going to explore that, and then maybe we can do a little update. But
Well, I guess I'll say, it's been 6 years since I have done this type of work, but yeah, it does sound like not much has changed. We didn't have online places to do this back then, so it was all phone calls. I will say, not all insurances operate in the same way. Some it's a phone call, and some it's a phone call to a case manager. Some it's like, hey, boom, case manager on that same first call,
hmm,
and you're good to go, and they can do it right then and there. And then some it's, oh, okay, well, go download this form on our website and fill out
hmm,
all the clinical information by hand, and go get the clinician's signature. Oh, by the way, that clinician's in sessions for the next 3 hours, so good luck. And then fax it over to the insurance company. Yeah, just a hodgepodge of just different tricks that you had to know. But definitely the biggest strategy, or just the biggest thing that everybody needed to be on the same page about, was like, try to get this done before Friday. Or like, like, if you're trying to get somebody in for next week on Monday, do it as early as possible. If the intake is on Tuesday, finish your note on Tuesday so that the team who's going to be calling can make that phone call as soon as possible, because it, can look like a multi-day saga, and then, somebody who really needs help is left waiting. So, yeah, that's my spiel.
Gotcha. Well, I hope people enjoyed it, but that's where our saga ends.
Yeah, it was a fun episode, almost nostalgic for me. And I would say it was kind of like one very long mental health business moment. So let's go ahead and wrap things up here. Hopefully updates next time. But that's it for this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you enjoyed the episode, we would love a rating or review wherever you are listening to the episode. And if you'd like to get in touch, you can always send us an email at sitandstay@ripsytech.com. And it was great chatting, Tom. I'll see you next time.
Thanks, Parker. Take care.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.